Hi, good evening. As usual, yes, it's Saturday, 6 p.m. And the Akufi Princess, one and only Mercy B, is right here on ETV Ghana. Girl vibes, no? The BI is getting tighter and tighter. We're streaming live on Facebook at ETV Ghana, and we're also live on HD Plus Decoder channel 114, and equally live on Go TV as well. And there's a message now. Thanks to my programs manager and my producer Rashida One. Thank you. And not forgetting my director. Director one. Director and sister baby. Johnny John. But I'm still waiting for the jollof no matter what. Maybe after the break we'll take the jollof. But I have beautiful doctors today on my set, and we are going to talk about a very important topic today about health, because when you know it's doctors and then it's about health, so our health are very important, and it's something that is really trending and worrisome, and so we are going to discuss today on Girl Vibes. And thanks to Adonko Next Level Premium Energy Drink, we'll give you the beauty tips for today. Yes, and I have my Vernon mineral water, so as usual I'll be sipping them little by little. So let's go for a breather. When we come back, we get to introduce our guest and also get into the discussion. Stick and stay. We'll be back. Yes, welcome back. This is Girl Vibes right here on ETV Ghana. And as I told you earlier, I have beautiful doctors today on my set. In the t-shirts now. Come dama. I have one friend that I'm crushing on right about now. Like, we are friends already, and they are from the Kolebu Teaching Hospital. And like doctors and kasa. In fact, Okutawan Masters na BBA style baby. And in the common bay testing and kasa. And we are going to talk about sexual transmitted diseases, or call it sexual transmitted infections. That is the STI or STDs, the causes, how you get to be affected, and how to cure it as well, the preventions and everything right here on Girl Vibes. We care about you. Just your looks, Miss Maho better here. And today I have with me Dr. Nelly Adade. Hey, she's a natural girl, yeah, Hello, Nelly. Welcome.
Thank you.
You're looking gorgeous. I like that. Thank you kind of vibe. Yeah, it's nice. And the red. God, I'm gonna catch him now. Miss red too. You didn't try, Charlie. Rashida, this one, dear. You didn't try. You should have let me also wear red. So, but it's fine. Nelly, want to know more about you. We know you're a doctor and a resident.
Yes.
Yeah, from the Kolebu. What more do you want us to know? Because I know you're bubbly on social media. In fact, I go social media. Nelly, or can be Dr. Nelly. I mean, you go to her. She'll tell you everything. But we'll also come to you. Ruth is here as well, so I'll also get to her. But first of all, you call Nelly how to tell us more. The exception of the social media and being a doctor. What else?
Okay, so I'm a pediatric resident in the Department of Child Health.
Okay.
What that means is I'm a specialist in training.
Okay.
So very soon, both of us will become pediatricians.
Oh, okay.
Yes, and then, so as part of our year group celebrations, we are just here to advocate on adolescent sexual health, adolescent sexual and reproductive health. So that's why we are here. For now, that's just about me for now. Yeah, okay. But then as you said, I'm very active on social media to just create advocacy for children. So it's the Pediadoc on Instagram, and that's just about it.
That's it. I also have Dr. Ruth Sam. Yes, she's also my new friend, and she's also a resident from the Kolebu Teaching Hospital.
Yes, please. So I'm Dr. Ruth Sam. I'm also in training to become a pediatrician. Hopefully by next year we'll be pediatricians, taking care of kids.
Wow.
Yes. I don't have a lot of social media presence, but also a lover of art, flowers and all that. And married with 2 kids.
Wow,
yes,
that's
please.
beautiful. With this buddy, you already have 2 kids? Wow, then you're beautiful. I mean, I've seen the ring on the finger of Dr. Nelly as well, but she didn't tell us. But it's fine. It's fine. Nelly, quick one. When we say STI or STD, what is that?
Okay, so as you rightly said earlier, that's sexually transmitted infections. And these are infections you get from having sexual encounter with someone, with a partner. So that's just basically it. And these infections sometimes you can get some of them through other means, but then the main mean by which you get it is through sexual interaction. So vaginal sex, oral sex, anal sex. So these infections are a group. So you can talk about the common HIV in that group. Syphilis, gonorrhea, they all fall under this broad heading of sexually transmitted infections or diseases.
Okay. Now let me come to Ruth. Ruth, Rebecca then Nelly Wakanina. It is a merba who was that for Bibi Kakre before which now also she made mention of sex. Is sex the only way you public me a STD and STI?
Okay. It's not the only way
Okay.
Some infections is the only way, but when you talk about an example like HIV, you can get it through blood transfusion.
Okay.
For the hospital day or day we make sure we do thorough screening to avoid that. And you can also get it when you share sharp objects with another individual. Those who engage in maybe this IV drug usage sharing a sharp objects like blades, shaving sticks, personal items it's a means through which and also even from mother to child transmit infection, HIV, hepatitis B on a day so being sena transmit amaneba. There are other ways but predominantly or you through sex.
Naturally, the sex no the main source.
The main source.
But on your sex and what it. And it said being HIV/AIDS naturally it doesn't necessarily mean the impano had sex in a way, but it could also be through blood and all that.
Yes.
Okay. And back cry and I come, Mr. For issues. I call a nail scene as that the kind of sharp
Exactly.
in some was a year nails nice in a cry. I want to cry. I learned the butcher HIV na all the STDs also. Now let's come to this. Set HIV. Or any STDs. I am funny kakra and they mention types maybe. So maybe you can mention you start up with the HIV and then you come to the syphilis and all that and then you explain. Now may who they this STD.
Okay. I'll focus more on the English aspects, not
Okay.
with the China account.
That's fine.
With these sexually transmitted infections, the way I present it, each
Okay.
one is different in the presentation. If you take gonorrhea, for instance, you would have a painful vaginal discharge if you're a woman, and then your partner may have a painful penile or urethral discharge. I hope say me use medical terms, baby, but there some milky discharge from the genital area, and then you may also have pain when you're having sex.
Okay.
Very painful, deep pain when you're having sex. You could also have burning sensation as well when you are passing urine. And see, when you take gonorrhea, these are some of the common symptoms you may have.
Okay.
If you take syphilis, for instance, you may have a sore at the genital area, and then the sore, the way it looks, they usually say it's a kissing. They are kissing ulcers into one on each side. Now say back together, a bit share. So you could have that as well in syphilis. That's the predominant presentation in syphilis, and then you could also have lower abdominal pain. And now say again, when you're having sex, it will be very painful.
That's a
as
syphilis?
well. That's with the syphilis.
Okay.
And then with the HIV, initially you may not have any symptoms at all, because your body will try to mount up a response, an immune response. So for weeks to months, someone may be infected with HIV and don't show any symptoms at all, and I'm normal.
Wow.
Actually, then you may now start having symptoms about malaria, kakra, baby kakra, brain, and then you're having body aches here and there. Then some people will go on to treat for malaria. Then they'll see that encore. Then they may start wondering what's happening. They'll go and do the test and find out that they have HIV. Yeah, so each one in the presentation, it's quite unique to each one of them. If you have hepatitis, initially you may not have any symptoms as well. But then as disease near progressing, hepatitis near liver infection, affecting liver no mainly. Until as the disease progresses, no be say after there be out Junsoa, aye Coca-Cola. And I say we near yellow. And I say we first started dua, we first started she. and now we now started air tartan, so then you know that no hepatitis not na air progressing, and if it continues, it may lead to liver cancer and now liver damage. Each STD has its unique presentation. There's no one single umbrella of symptoms for all of them.
For all of them.
Yes, please.
Wow, great education there. Now let me come to Dr. Ruth. Ruthie, Nelly mentioned all of this. Now, can one person be infected with all this at the same time?
Oh.
You know, can somebody get HIV, syphilis, gonorrhea at the same time? Is it possible?
That person will be powerful. But yes, it can happen that you have one person who will be infected with more than one STI at a time. Depending on your lifestyle, if a practice a risky lifestyle, you expose yourself into, you can have one person and both HIV, hepatitis at the same time. Into one thing because of that period now, you are walking around that you are not sick, until you will not know that you may even be harboring the HIV. Then you move on to another person who has hepatitis. Now you become infected with hepatitis as well. Because of that period now, you don't have any symptoms. There's nothing happening to you. So even for some people up to years, they can be there normal. Until you may have even forgotten that you met up with one partner who may have had HIV. You've picked the infection, but you don't have signs. You meet another partner who now has hepatitis, so you can pick another infection. So it can happen. It can happen.
And in this case, you transfer the HIV to the person and take the hepatitis.
Exchange is no robbery.
Wow. I do.
It can happen.
But you being at the hospital, no, you know, such cases are nipa crowing at this, you're burning in article.
Oh, personally, me she'll be away now maybe more than 4, but 2, at least 2. Me, who be them. Be like the example I gave, both hepatitis and HIV. Yes. I don't know about
Nelly. Have you?
I've not seen, as you said, like 4. Yeah, but at least 2 infections ongoing at the same time. Yeah.
But how will I know that I have this both at the same time? You know, let's say, for instance, if I have HIV and at the same time I have gonorrhea or syphilis, how will I be able to tell that I have those 2 at the same time? Is there any symptoms to show that I have both?
So as I mentioned the symptoms earlier, they are very specific to each STI.
Yeah.
So you are a young lady and then suddenly you see ulcers in your vagina. You should get worried that what's happening. How come menya crew over there, and then maybe another crew, then maybe you're having sex and then it's painful? You should not sit down. Definitely, you know that you need to take a step. You need to do something about it. So when you start having, you know your body. So when you start having abnormal symptoms, things are showing up here and there that don't make sense, I think you don't have to sit down. You have to go to the hospital and then find out what is happening, get tested, and then get examined, tested, and then take the necessary steps.
Taking the steps, is there a way to, first of all, treat myself at home before going to the hospital, Rudy?
Like we are all advocating now, the best thing is report to a hospital. Report to a hospital, because in medical literature, I'm not aware of any home treatments and other home remedies that can actually cure or treat. We can practice preventive measures, which I'm sure we'll go on to talk about later. But in the house, to say that you can maybe take this or apply this that will solve the problem, no. The best thing is to actually seek proper medical attention.
Nelly, what about the orthodox way? Is that the best way? Or we can also go to the herbalist and, you know, find our way out?
Well, for now, I know we have the herbal medicine in Confanochi now, they've started the program. So
okay.
I don't know what they do. I don't know what their course entails. So I cannot speak for them. But at least I can talk about the orthodox part because that's where I'm trained in. So the orthodox way, yes, I would say is the way to go for now because I don't know what's happening on the herbal side. If there are any herbal medications, I'm not aware.
Okay.
And I'm sure if there are, then it will be FDA approved and then maybe Ghana Standard Authority would also give approval for those herbal medications to be used. But as I sit here, I'm not aware.
Of that.
Yeah, so I can't say.
But sometimes in our buses and trotros, we hear them shouting, more HIV, more coquader, more, in fact, gonorrhea and air tati pa, HIV is it. And I'm said and jeans, so we don't really see them. But gonorrhea, sister, I bet you right now, go to the circle trotro station and you see them there.
And it's interesting that they have one drug that will cure everything.
Everything, you know.
So what I always keep saying is, take it to FDA if you are very sure of what you are selling.
Okay.
And if you know what you are selling is legit, take it to FDA. Let them do the test. And then why are people suffering? Let them test. If it's approved, then people will, hallelujah, people will have a cure or a treatment of a sort. But because they are not very sure of what they are about, they know the people they will sell it to, the gullible people, sorry to say, and then they will sell it to them.
My sister, your champion, you must some question. He's what summer. Let's go for a breather. When we come back, we get to vibe more here. Stay tuned. All right, welcome back from that quick break. So let's say a big thank you to our Dunkel Next Level Premium Energy Drink. I want to be here. Also, here na see my and beauty tips no. Yes, brown na per vitamins, sister. Na here energy. Make sure you buy a Dunkel Next Level Premium Energy Drink. I mean, if you're walking in traffic, wherever, if you visit the mart, you get some to buy. So call them for bulk purchases on 020-4898-698 or 059-2610-998. Okay, I don't connect level, no limit, as I say. It's a now, and then we are talking about STDs, or call them STI. That is the sexual transmitted diseases. It's not only through sexual acts. You can also get it from various, ways. So be careful with that. But the education is still going on, and we are streaming live on Facebook at ETV Ghana. Dr. Nelly is here, and I also have Dr. Ruthie here. So Nelly, before the break, let's say, when I in fact, but to that America, there are some that are approved by FDA, but so far, mentioned Dudumo, but you mentioned the Confanoche.
I know so their school has started the herbal medicine course. Okay. But then I don't know what they are really about, so I can't really speak much.
Okay, so there's a possibility.
There is, but I don't know.
Anyway, so there's a way of testing. We know the pap test. Is there a way that you can also use that way to test for HIV or any of the STDs?
Okay, so usually the pap smear is specifically to test for abnormal cells and then the human papilloma virus, HPV. And the HPV is actually one of the STIs because you could actually get it through sexual means as well. So we want to test and know if you are likely to get cervical cancer because the existence of this HPV could make you get cervical cancer. So the pap smear is specifically for that. So usually with the STIs, most of them are done by blood tests. Okay. So you go to the hospital. So some are actually rapid tests. That's most of the time we use the rapid test. I say you go to the pharmacy when you want to test for malaria, then they just prick your fingertip and then take the blood sample. So most of them are like the HIV, hepatitis. Most of them is the rapid test. Okay. So that one you have to go to a hospital, seek proper medical treatment for them to test it. I'm not sure if pharmacies are allowed to do the test for HIV, syphilis in their facilities, but I know in the hospitals, yes.
Okay. Okay. Are all STDs curable?
No, unfortunately, not all STDs are curable. like the HIV, for instance, there's no cure. So it's treatable, it's manageable. Yes. We manage the symptoms. They are usually put on long-term medication, antiretroviral drugs. I'm sure you may have heard of that. But it's not going to cure. What it can do is it can decrease your viral load to a very, very low level. So people are able to still live the best of their lives because they are still strong and healthy, but they will still be carrying the infection. But others like gonorrhea, syphilis, yes, there are antibiotics that can be given to get rid of the infection. But not all of them are curable. Yes.
That is the HIV, for
HIV,
instance.
yes.
But gonorrhea is curable.
Yes,
and
it
syphilis
is.
is curable.
Yes, it
But
is.
HIV, yes,
Yes, HIV, and then
Most
I
of the
think
viral
most of the viral ones are difficult to cure. So the one she just mentioned, the human papilloma virus, HIV virus, even with hepatitis virus, it's also very difficult. You cannot always, in fact, it's not curable. You just have to hope that by living a healthy lifestyle and practicing certain measures, it doesn't progress for you to get the worst outcome of the liver disease.
Why is it so? Why is there no cure? You know, it's HIV has been in the system since, you know, my infancy. Like we heard about HIV. I remember there was a time that not Ghana, I'm the HIV near Accra, and then suddenly it popped up. In fact, Ebetna being a HIV, and then we all started just like the way the coronavirus came. You know, Mbeno people. But now, you know, people, I think the education is going wide now, so people are being careful. You know, though we are being careful, we are also getting more knowledge about it that, you know, do they during you hope but then if you visit the hospital, there will be medication for you to still live your normal life and all that, and people can still get close to you. But there are some people that still are afraid that so be with HIV, even the sweat can give you HIV. Is it that way? Is it true? Is there any truth in that?
No, it's not. So that's the reason why we are also doing what we are doing. We are trying to create awareness amongst adolescents, girls, women. We are trying to just create awareness and let people know the true facts about these infections. Like the name is saying, sexually transmitted infections. It's not transmitted through sweat. It's not transmitted by holding someone's hand. It's not even transmitted through coughing on someone. It's not like that. So
what about kissing? If I kiss you, can I get HIV?
So yes, it's through exchange of bodily fluids. So it's been if you do have a cut in your mouth, your partner also happens to have a cut in the mouth, and there's exchange of fluid. It's possible, exchange of blood through that means, yes, it's possible to get the infection.
I remember the hepatitis B, that one I heard through sweat you can get it. Nelly.
So the hepatitis B, it's mainly through blood means, but then there's very little, just like the HIV as well. So some of them you can transmit them, as she said, through other body fluids, like semen, like sweat, like breastfeeding. But then those ones, the risk of infection is very low as compared to the main sexual means. So that's what it is with the other bodily fluids. It's very low, but then there's the chance that someone may get an infection from that source. But then the main one is through anal sex, vaginal sex, oral sex, because then that's where you know that a lot of the exchange will go on during those sessions.
Now, between a man and a woman, who is at high risk of being infected?
This question comes up quite often when sexually transmitted infections are being discussed. So it's actually interesting. Everyone is at risk of getting STIs. We are all at risk of getting STIs, depending on the kind of partner you have. If your partner is promiscuous or is living a risky life, you're at risk of getting, you may be sitting down quietly in your corner, but then your partner is roaming all over Accra, and then he comes, you would get it. It's not because you're sitting at home quietly, you are not going to get it. But then there are different school of thoughts. So the common one is that women are more likely to get the STIs because we are the receiving end. If you look at the way our genitals are, we are more at the receiving end. The penetration has to go on. So we are more at the receiving end. So we are more likely to get these STIs as compared to
the men.
Yes.
Until your buyer no order who ye pa.
Exactly.
But yeah, man, then I say who ye pa.
So
And I'm talking about the prevention. You know, how do we prevent it?
So the prevention, so ABCs. When it comes to STIs, you can never, I mean, you can't overemphasize your ABCs.
Okay.
The first one is abstain.
Okay.
You are not ready for any kind of games with someone. You don't know what the person is doing out there. You don't know what the person's plans for you are. Abstain. As a young person, you have your dreams and life ahead of you. Abstain if you can. That's the main message we usually want to preach, especially to adolescents. Abstain. Focus on your books. Focus on your dreams and aspirations. Abstain. If you won't abstain, or it's difficult to abstain, because we have to be frank that it's quite difficult for young people to abstain. So if it's difficult for you to abstain, and you can ensure that your partner is faithful, or you yourself you are faithful, then
My director is saying very true. The abstinence is very true. People can't. In fact, I think my director, he can't.
so then we come to the B, which is be faithful. So try and be faithful in the relationship. So be loyal to each other. That we know we can't abstain. We are in this. So let it just be you and I in this relationship. No third party. If if being faithful cannot work, and you know that the person you are with is not being faithful, please use a condom. And when it comes to the condom use, it's not just about the male condom. There's the female condom as well, which a lot of women shy on and refuse to use because they say it's a little uncomfortable. But then you know what you want in the relationship. You know what you want in your life. So if the man is not willing to use a condom, then be the one to take the risk. I mean, protect yourself and then use the condom. And then education, like we are doing, creating awareness, public education. We have to drum it over and over and over. The STIs are real. Until you get it, you would not, you think it's a joke. People are just like how Corona came and everyone thought, oh, until you get it. So education, education, education. We can't overemphasize these points.
Then we need you almost every week to come and give us the education, because the abstinence isn't the crying. The crying are it's very difficult to abstain.
It's
Though,
very difficult.
you know, most people are not married, but you know, they believe in, you know, having the affair, you know, to lead into the marriage and all that. Now, Ruthie, let me come to you. What about we, the marriage people that are married? You know, what do they do? How do they also prevent? How do you talk to your partner to understand that STDs are real and all that? Hold on, I'll come to you. But let's go for a quick break. When we come back, you know, we get to hear Dr. Ruthie on that angle. Stick and stay, we'll be back. Yes, I'm excited that we are back actually, because I was waiting for Ruthie's, you know, education on that side. So we are back. And so we also streaming live on Facebook at ETV Ghana. Please make sure you share. And then come on, no one here, papa. In fact, what do be a done the partner, but we know HIV. And then today we know it is still not curable. Enya. But there is a way to manage it. That is, you go to the hospital and you be put on medication. Thanks to Dr. Nelly and Ruthie. Ruth, yaba. I mean, the people that are married, what do they do? How do they, you know, prevent all this?
Yeah, so like Nelly started to say, it all starts with your mindset. So.
Okay.
You have to try and really make that conscious effort to try and be faithful, because like you're saying, one partner is out there, you have no idea, you are open, and then the next thing you know, and most of the time you even find in our facilities that we do this screening exercises during, let's say, sometimes antenatal.
Yeah.
So someone has no idea, I'm pregnant, I'm going for my routine antenatal, and that's when I find out today I have HIV, and it's so shocking. I'm excitement to go hospital why you always have to just try and make the conscious effort, and then using protection, condom use, both male and female.
The married people too?
Yes.
Hey.
yes,
then watch us.
but because
And how do we give birth? Using the condom.
so that's the reason
Or
why
we should plan.
planning.
When we want to have fun, we use the condoms, and when we want to make babies, we should.
Yes, that's why I'm saying that even most of the time, circumstances we find out is when the woman has gotten pregnant, and then she's reporting to hospital. It's done routinely for everyone, and that's when they find out when the problem has already occurred. That's why we really try and hammer on the be faithful, be faithful, be faithful. And you even have situations in which are one part ninya,
Okay.
the other part ninya. There are measures to try and reduce the partner from.
How is it possible?
Yes.
We still have sex. We make love, we kiss, just as you mentioned, and
so the using protection comes in, and then also when you are on the medications and your viral load, we call it the amount, like the number of viruses or homogenum were very lower.
Okay.
The chance of you actually spreading it also will form. There are measures that are put in place.
okay.
There are measures that are put in place.
And we hear there are some medications that you can even take to prevent STIs. Is that true, Nelly?
So this is the first time I'm hearing this.
Are you sure?
Yeah, I'm sure. This is the first time.
I'm surprised you don't know this. Ruthie, what's on to that?
No,
Oh no,
really.
Masheda. Because we hear mostly, best now say Papa no, the big men. I will use to endure to prevent STIs, Naze. So they like to
Really?
explore without even thinking about it.
Then
We
they
hear.
should let us know so that we
Also,
we
it
research
is not
into it.
true. There's no medication like
haven't-
that.
This is the first time. Truthfully, this is the first time I'm hearing this. Medications to prevent STIs.
Yes, to prevent STIs.
No, this is the first time.
Especially the HIV.
Wow.
Really?
Yeah, we hear people are on medication that prevents
prevent
HIV.
HIV.
I mean, if you've also heard it, please add up to your comments on Facebook, because I hear that all the time. That people have, are on medication, to prevent STIs, especially the HIV.
So maybe what they are on are medications to help reduce the viral load, like Ruth is saying.
No, not that one. We also hear that people have medications to prevent it.
Then
But anyway, since
you've
you're the
given me
doctors,
a reading assignment, then I would go and find out.
yes, please check it out for me, because I really want to be sure.
I've not heard of this before. And if there is something like that, then it means, why are people still getting HIV?
Okay.
Exactly. So why are people still
What
getting
about the
STIs?
mothers that are pregnant? Is there a way to prevent the kids from getting it?
So there's what we call the mother-to-child, prevention of mother-to-child transmission.
Okay.
So there are measures that are put in place to make sure that the likelihood of the unborn child getting the infection is very reduced, very low. So depending on what kind of STI the mother has, and then what regimen we put in place, and even the process of delivery, there are extra precautions that are taken to make sure, say, isn't too much mixing of blood between mother and baby, so that baby's chance of getting the infection will be reduced. Mother is put on medications. If it is the bacterial ones, that was one thing I realized we forgot to mention. Say STIs, no, they are the ones that are bacterial, and they are the ones that are viral. And the bacterial ones now we use antibiotics to treat them. And then the viral ones now, the ones that we use the medications to try and reduce the load and curb them, because the viruses change their nature. So it's very difficult to get treatment for them. And that's why HIV has been in existence for so long and we are not getting a cure. Yeah, and that's why hepatitis is difficult to get a cure, because the viruses change their nature every now and then. So with if you have an STI that is viral, we put on medications that will reduce the load of the virus in your system.
Okay.
Yeah, so during pregnancy, there are medications you take. If it's syphilis or gonorrhea, you'll be treated thoroughly. Yeah, so the baby's chance will be very reduced. But to say that so that you wouldn't get, it's quite new to me, I must say.
Okay, now let's come to the differences between the hepatitis B and the HIV. Now we get to know that there's no cure for both of them. Now, which of these two is very dangerous? And which of them is also common in Ghana?
So both are common in Ghana, truthfully. Hepatitis B is on the rise in Ghana. Everyone, it doesn't spare anyone. Whether you're a mother, you're a husband, you're a child, anyone at all is at risk of getting hepatitis B. It's the same with HIV, and they are both viral infections, as we said earlier on. Now the thing is that so for a child you can get it from your mom. It's likely you could have been infected through childbirth or throughout the period of pregnancy and delivery. Yes, but then HIV is also the same, and there are measures that are put in place to try and reduce the infection or the transmission to the child. They are both common, and which one is worse is difficult to tell because HIV is systemic. When I say systemic, it means when the disease advances, it affects every part of your body. So you could have kidney problems from HIV, which we call HIV nephropathy. HIV could affect your liver. You could have a heart disease from HIV, cardiomyopathy. So HIV is systemic. It affects every organ.
Part of the body.
Yes, and especially when it gets to the end stage, which is the AIDS, the AIDS stage, it's advanced. So everywhere is infected. Every organ is affected. But hepatitis is very specific to the liver.
Okay.
It's very specific to the liver. So if the disease progresses without any intervention being put in place, then it could lead to the liver cancer or end-stage liver disease. Okay. So that's the difference between them. So to say which one is worse, I don't know if I'll say, I can't say hepatitis B is better than HIV because your liver is one. You have just one liver in your system. So if it's damaged, then that is it. So I can't say HIV is worse or hepatitis B is better.
They are both dangerous.
They are both dangerous.
Yeah. It's like you're saying which of these two bad things do you prefer? That's what.
Okay, so there's no way you have to choose any of them. So we just have to know from the education that they are all dangerous and then we should stay out of it. Thank you. Now let's come again to where we buy our foods. We hear them sometimes, and I remember there was a time that there was a place, I don't want to mention the name, it broke out that one of the cooks or the chefs, you know, is affected by HIV, and she's spreading the HIV out through the foods that they sell at their restaurant. Is there any truth in this, that people can be, you know, get this STDs through the foods that they eat or they buy outside?
Yeah.
Ruthie?
I think that's very, very unlikely. Like we keep emphasizing, it is mainly through sexual transmission. Yes, through sexual transmission. Some of these ones, like the viruses, when they are even put on, let's say, surfaces, they have a time frame in which they are active. Okay. So for you to say someone who cooked, even if the person exposed some of their bodily fluid on the night, no, it's unlikely for it to even last through to the time
that long
it was cooked. And for you, no. So it's really unlikely. If it is, even with the hepatitis that we are talking about, there are different types. There's one that is hepatitis A. Yeah. That one is even a different type. Sometimes people tend to confuse the two. Okay. So we have hepatitis A, B, C, it goes on. Okay. It is the A that can be transmitted through food, contaminated food.
That is the A.
And that is not a sexually transmitted disease. Like
and are the symptoms the same for the B and then the A?
No, they are not.
Can you tell us?
They are not the same. They both affect the liver. So they can manifest the same as in the jaundice, that's the yellowing of the eyes, the urine, distension and all. But the initial symptoms, you usually have vomiting, diarrhea, which you don't classically see in the B. I'm sure, I hope I'm not confusing.
No, not at all.
So they are not the same. So that's what usually people tend to confuse, that they say hepatitis. Sometimes people don't really let you know we are saying hepatitis A, we are saying hepatitis B. So even when they are I know most institutions, when they are employing people, they go ahead and screen, and they would want to check to know if you are free from these things. And then the supervisory bodies also go around and check to make sure that the environment they are cooking and all that should be free from these type of infections. Yes.
Nelly, I wish we could talk more and talk, but our time is far gone. But before I let's go, Ricky, out. Before I let go of you both, I want to know, can somebody that has been treated from gonorrhea, you know, get to be affected again?
Yeah, it's very likely, especially when your partner has not been treated. So if you are infected with any of the STDs, especially the ones that are bacterial where you can take an antibiotic and you treat yourself, you are fine. But you go back to having sex or a sexual encounter with your partner who has not been treated, your likelihood of getting reinfected is very high. So some people will keep getting the infection over and over and over, and that's why contact tracing and then treatment of their partner is very necessary to make sure that it's very important to make sure that both of you are free.
Okay.
Else you would go get treated, come back, so you get a recurrent infection. And when you have recurrent infections too, they do not help you, because some of the STIs like syphilis and gonorrhea, they actually affect your fertility and can cause infertility in the long term. Yeah, so like a woman, you can get infertility in the long term when your STI is not well treated. So to make sure that both of you, to make sure that you are well treated and you are free, your partner must be treated. So someone can actually get an STI and get reinfected again because the partner has not been treated, or goes to meet someone else who maybe breaks off this old relationship and goes to meet someone else who also has his or her own baggage, and then you get
bring
infected.
it back to you.
Exactly.
I emphasized on the gonorrhea because I know you mentioned HIV not being curable, and then the gonorrhea we know is a bit way to treat it. But thank you for making it all in one for me. Now, Ruthie, you're cool, but I see we then debate. But is there a way of living STI-free life?
Oh yes, there's a way. That's what we are trying to advocate, and we are even trying to target younger people. The ABCs, like we've advised, abstinence, abstinence, abstinence. There's a reason why that was the A that was started with, because that's the most effective way. If you are not having sex, you are not going to get a sexually transmitted infection, or it's very unlikely that you will get a sexually transmitted infection. If you do want to...
And then you add in with your final words.
Yes. If you do want to be faithful, see condom use. But we are coming from Kolebu. We are targeting more adolescents, girls. You have your dreams ahead of you. We just want to advocate that make informed choices. There are messages at the back of our t-shirts. I don't know if you want to have a look.
At the back,
Yes.
So try get up small. Today, my set is on another level, so you can do anything.
You can see that we are saying that if you rush,
you will
crash.
Thank you.
So do not rush.
Do not rush, so you don't crash.
And mine says you should be empowered
and be safe.
Yes.
Thank you. Please have a seat. You know, when they turned, you saw everything. It's beautiful. So please make sure you stay safe and be empowered, and all of that, all those messages. But I'm not going away without taking Nelly's final words. No, I won't do that. So Nelly, your final words.
My final words, as Ruth said, you have your whole life ahead of you. You have your dreams and aspirations. You know what you want to be. Go get it. Make informed sexual health choices. Do not rush. Take your time. There's always light at the end of the tunnel. So go for it.
All right, you heard it from Nelly. She's a beautiful doctor from Kolebu Teaching Hospital, and she came with her colleague. Yes, my Ruthie darling. She says stay safe, okay, and please make sure you use the condoms. They are very important. Man, kadem pets. That's the enjoyment. Ka crave you. What you say? You get to waste your life. We care about you. ETV Ghana. In fact, you're more need you're more upon was in the account. And Saturday MMC Live. Yes, the music, magic, and comedy is happening at the Grand Arena. Make sure you get your ticket. If you don't have it now, I mean, what are you waiting for? So you can do it through the Momo, and make sure you use the short code *71333*10#. If you don't know about the MMC Live, I'm telling you, the best artist of the year 2022. Yes, that's Skiddy. Yeah, the Sugar Daddy. He's performing, and my very own songstress Adina Tembe is also performing, and the man emceeing Charlie. If you want to laugh, then who else? I mean, which other comedian in Ghana? Clemento Charette. Yes, it's the MC. I need to brag about him because I love him. I'm a fan of Clemento, so I'm going to be there. Make sure we meet and have fun, take some pictures, and enjoy some good Ghanaian music with a bit of magic. Now remember the last time. Not on easy, you see a human body part. Nelly, what shiny panity, and then the next stage you see the head form. Oh yes. So please come, get your ticket.
I'll be there.
Thank you so much. The tickets are just 100 cedis for single, and pair with the Ruthie, 450 cedis per. You get to save 50 cedis. So you can do that on Momo. Let me mention the Momo line again. That is *713 *33*10#, and then you get with your Momo. And this event is sponsored by Wupro and Silverbird Cinemas, and then Perception Management International, with media partners YFM, MX24 TV, City FM, Pulse Ghana, Happy FM, my very own Eniji Nkwa, and then ETV Ghana. I mean, Daily Guide, BNFT, NYDJ Live, and Amayo Deborah. Oh, talking about Amayo Deborah, happy belated birthday to him. He's one of Ghana's bloggers that I love and admire so much. And also Ghana Web, Plus FM, and Radio Universe. Please get your tickets. It's happening tonight. And baby, I own with just 100 cedis for single and 150 cedis. Get your boo along and your bae along, and then Rashida will go. Okay, you and I, maybe 150 cedis pay. Will you pay or I should pay? I know you say I should pay, so don't worry. I'll pay and then we get to go. Director, maybe we'll do the threes, and so 100 cedis for you and 150 cedis for myself and then Rashida. Or maybe we'll pull an else along. Our one and only IT, personnel here. So we say thank you for watching Girl Vibes. To my crew, I love you so much. Rashida is my producer and my stylist, one and only Reggie Brandy. Thank you, darling. My cameraman, Kafidi. Thank you so much. And I'm the member in the Kakraka, Mama Kasakaka. Johnny, don't do that. Thanks to my director, Johnny. Have a good night. Thank you for watching Girl Vibes.